Assalamu alaikum. I'm Dr. Hamd, and today we're going to be discussing the gross anatomy of the popliteal fossa. This is an important region which is present on the posterior aspect of the knee. And today we're going to be talking about its boundaries, its contents, and also the relations of structures within the popliteal fossa, as well as the structures forming the roof and floor of this very important region. We shall also correlate the basic anatomy with the clinical conditions related to swellings behind the knee. And in the end, I have a few MCQs for you. So let's start by defining the popliteal fossa. You can see over here that this is the red-shaped area which is present on the posterior aspect of the knee, and it is a diamond-shaped intermuscular area. The boundaries are simply the upper medial, upper lateral, and lower medial and lower lateral. So first, let's look at this red line, which is representing the upper medial boundary, which is formed by the two muscles, semimembranosus and semitendinosus. Now, the first one, which is semimembranosus, its origin is from the ischial tuberosity of the hip bone. And this muscle then inserts into the medial condyle of the tibia. The semitendinosus is a slender muscle. Its origin is also from ischial tuberosity of the hip bone, and it is inserted into the upper aspect of medial surface of the shaft of the tibia. Let's look at these muscles in a cadaver. So in a dissected cadaver, you can see the area which is highlighted as the fleshy pink muscle is representing the semimembranosus. And this is the posterior aspect of the right knee, that is the right popliteal fossa. So here is the medial region, and superficially is the semitendinosus muscle. It is lying superficial, or you could say posterior to the semimembranosus muscle. Both of these muscles together form the upper medial boundary of the popliteal fossa. Whereas when we talk about the upper lateral boundary of popliteal fossa, this is formed by the tendon of biceps femoris. Now, biceps femoris is a muscle which has two heads of origin. The first is from the ischial tuberosity of the hip bone, and it is known as the long head of the biceps. The other one, which travels a shorter course, is the short head of biceps, which arises from the linea aspera on the posterior aspect of the femur and also the lateral supracondylar ridge of the femur. Both of these heads converge and are inserted into the head of the fibula, which is the lateral bone of the leg. Here in the dissected cadaver, you can see the biceps femoris, the fleshy muscle in pink, is forming the upper lateral boundary of the popliteal fossa of the right side. And both these muscles, these semitendinosus, semimembranosus, and then the biceps femoris, they meet at an angle which is known as the superior or proximal angle of the popliteal fossa. Now let's come to the lower boundaries of the popliteal fossa. The lower lateral boundary is formed by the lateral head of a large muscle present in the posterior aspect of the leg, which is known as the gastrocnemius. Here you can see in fleshy pink is the lateral head of gastrocnemius forming the lower lateral boundary of the right-sided posterior aspect of the knee. Whereas the medial head of gastrocnemius forms the lower medial boundary of the popliteal fossa. So then again, in the dissected cadaver, here in pink, you can see is the medial head of gastrocnemius. Where the medial and lateral heads of gastrocnemius meet in the midline, this forms the distal, or that is the inferior angle of the popliteal fossa. Let's look at this muscle as a whole, the gastrocnemius. These are its medial and lateral heads forming the lower boundaries of popliteal fossa, and the belly, the fleshy bellies of this muscle, they unite and they form this strong tendon which is known as the tendocalcaneus, as it is inserted into the calcaneum bone of the heel. Now, looking at all of these muscles together, here they are forming this intermuscular area behind the right knee joint, which is the popliteal fossa. So this is the upper lateral boundary formed by the biceps femoris, the upper medial boundary formed by semitendinosus, semimembranosus, the lower lateral and lower medial boundaries formed by the two heads of gastrocnemius. And these are the structures now which are present within this popliteal fossa. What about the structures which are forming the floor of the popliteal fossa? So this can be considered as the base of the popliteal fossa. We simply remember these three structures from above downwards, 1, 2, 3. These structures are, number one, the posterior aspect of the femur bone, which is in this region known as the popliteal surface of the femur. Number two is the capsule of the knee joint strengthened by the oblique popliteal ligament. And number three is the popliteus muscle. Popliteus muscle has its origin from the lateral femoral condyle, and it is inserted into the upper part of the posterior aspect of the tibia bone. Now, when we talk about the roof of the popliteal fossa, remember it is covered by a fascia which is known as popliteal fascia in this region, and this is continuous with the deep fascia of the thigh, which is fascia lata, and also with the deep fascia of the leg, which is fascia cruris. The popliteal fascia is the dense layer. It is often perforated by the caudal nerve and the short saphenous vein, and these serve as important landmarks in the direct posterior approach to the knee joint. Now, what is present within the popliteal fossa? Well, the contents are largely hidden by the distal part of the two heads of the gastrocnemius muscle. So especially hidden if we separate the two heads of gastrocnemius muscle, then these hidden contents will be visible to us, and we can enumerate these contents as, well, first of all, the very important popliteal vessels, and along with them is the short saphenous vein, the important and prominent nerves, which are the tibial and common peroneal nerves. Also, other nerves are present in popliteal fossa, including caudal nerve, the posterior cutaneous nerve of the thigh, the genicular branch of obturator nerve, which supplies the knee joint. They're also present about 6 lymph nodes and fat in the popliteal fossa and variable number of bursae. Now, if we want to remember the relations, we have this mnemonic which helps us remember AVN. AVN from deep to superficial. A represents artery, which is the popliteal artery, V for the popliteal vein, and N is for the nerve, which is the tibial nerve. Now, these three structures, the popliteal artery, vein, and the tibial nerve, are present in the popliteal fossa deep to superficial, which means the deepest of these, or we could say the most anterior, is the popliteal artery. Behind that is the vein, and then posterior most or superficial most is the tibial nerve. Now, here is the diagram showing us these contents of the popliteal fossa. Here are the boundaries. Upper medial aspect in this case is semitendinosus and semimembranosus, because keep in mind what we're looking at over here is the left popliteal fossa. So this would be the lateral aspect, and over here, this would be the medial aspect, because this is the left popliteal fossa. And over here, if you follow the pointer, is the lateral aspect now. So upper medial boundaries formed by semitendinosus and membranosus, and the upper lateral boundary is formed by this here biceps femoris tendon, whereas on the lower side, the lower lateral boundary is formed by lateral head of gastrocnemius, and the lower medial boundary by the medial head of gastrocnemius. Now, here the contents of the popliteal fossa. As I told you, the deepest structure is the popliteal artery. Behind that is the popliteal vein. If you recall from the previous lectures, the popliteal artery and vein, collectively known as popliteal vessels, are the continuation of the femoral vessels from the adductor canal as they exit the adductor hiatus and enter this here popliteal fossa. Then you could see the most superficial, or we could say the most posterior structure, is then the tibial nerve. And we can see also running alongside the tendon of biceps femoris is this here common fibular, also known as the common peroneal nerve. These two nerves, tibial and common peroneal, are the terminal branches of the sciatic nerve of the posterior aspect of the thigh. So we can also see other nerves. We can see over here, this one is the branch of the tibial nerve, which is the medial cutaneous nerve of the calf. And also you can see the branch of the common peroneal, which is the lateral cutaneous nerve of the calf. Also, we can see the short saphenous vein. It is entering the popliteal vein within the popliteal fossa. And here are the genicular branches to the knee joint. And here are the muscular branches of tibial nerve to the muscles. Now, remember that the popliteal fossa is about 2.5 centimeters wide, and when its boundaries are separated, only then its contents are revealed. The popliteal vein is superficial to the artery within the popliteal fossa. And also another important relation to remember is that the popliteal vein crosses the popliteal artery from its lateral side above to its medial side below. Also to keep in mind, as I told you before, the sciatic nerve divides into two terminal branches, which are tibial and common peroneal, and these terminal branches are given off in the superior angle of the popliteal fossa. The common fibular nerve descends on the medial side of the biceps femoris tendon, while the tibial nerve crosses the popliteal vessels posteriorly from the lateral to medial side. So the popliteal vein crosses the popliteal artery from the lateral to medial side, and the tibial nerve also crosses both these popliteal vessels from the lateral to medial side. So let's look at the contents now in the dissected cadaveric specimen. You can see over here that this is highlighted for you. This is the tibial nerve, which is one of the terminal branches of the sciatic nerve present within the popliteal fossa. And in the next one, you can see here is the common peroneal nerve lying, you can see in close relation to this biceps femoris tendon. This is also a terminal branch of the sciatic nerve. Popliteal vein, you can see over here highlighted in blue, is present within the popliteal fossa, but the deepest structure you can see is the popliteal artery. And remember, in the lower part of the popliteal fossa, this popliteal artery is going to divide into its two terminal branches, which are anterior and posterior tibial arteries. So this was a quite brief description of the popliteal fossa, its boundaries and contents. And the applied aspect of the popliteal fossa, what you should know about is that there could be a swelling in the popliteal fossa. And one cause of that swelling behind the knee could be semimembranosus bursitis. We know that bursitis means an inflammation of the bursa. Well, the semimembranosus bursa is located between the insertion of the medial head of the semimembranosus muscle, in between its insertion and also the medial head of gastrocnemius. So that is the location of this bursa. If it is swollen, then the location of the swelling would be on the posteromedial aspect of the knee. And this bursa may or may not communicate with the joint cavity. This has to be differentiated from another swelling which might be present behind the knee, which is the Baker's cyst. The difference is in the location. The Baker's cyst is going to be present in the central part of the popliteal fossa, and this is due to a pathological diverticulation of synovial membrane through a hole or a gap in the posterior aspect of the capsule of the knee joint. Okay, so now that we've discussed these important structures, we've talked about the popliteal fossa, here you've got to identify, and I would like you to take a minute, is this the popliteal fossa of the left or right side of the body? How can you identify that? And can you also identify the label structures 1, 2, 3, and 4? So if you are able to do this, then that means you were listening, because this is the region on the right side of the body. Now, how can we tell that this is the popliteal fossa of the right side? Well, you can see that this is the tendon of biceps femoris, and it is accompanied by number 1, which is the common fibular nerve. This is on the upper lateral aspect, whereas the upper medial boundary is being formed by semitendinosus and semimembranosus muscles. And then below, the two heads of the gastrocnemius muscle are forming the boundaries of the popliteal fossa. And in the middle, the important nerve is the tibial nerve, and the vessels are, of course, the popliteal vein and the popliteal artery. Remember, a popliteal pulse can be felt in the popliteal fossa, although it is difficult to palpate because it is lying so deep within the popliteal fossa. However, the pulse can be detected by palpating just medial to the midline. Okay, so now here is an MCQ for you. You've got a patient who has sustained lower limb trauma and has damaged the posterior tibial artery. So you will be concerned about blood supply to which of the following regions? So the damage is to the posterior tibial artery. Which region is going to be affected? Our knowledge of anatomy, the discussion we had also in the previous lectures, makes us recall these different regions. So posterior tibial artery, is going to supply the posterior compartment of the leg over here and the sole of the foot. This is the region of supply of posterior tibial artery, the posterior aspect of the leg and the sole of the foot. So this is the region going to be affected. Now here's the next MCQ. What are the chief deep veins of the leg that are of concern when we are thinking about deep venous thrombosis? So deep venous thrombosis affects which veins of the leg? We know it is the deep veins, it is the anterior and posterior tibial veins which are going to be affected. So this is today's topic on the popliteal fossa, and I hope this was easy for you to understand. We talked about the important boundaries, the contents, the relations of the contents of this region. So if this was helpful for you in understanding the gross anatomy of the popliteal fossa, stay tuned for more lectures of anatomy. And for that, like and subscribe to my YouTube channel, AnatomyMentor. And you can do that easily by just pressing on my picture, which is going to appear at the end of this video. So thank you and take care. Allah Hafiz.